Hello everyone. I'm going to give a broad overview of what the Global Health Network is and also some updates from what we have been doing recently. The Global Health Network is a vast community across the world which works with the goal of bringing equity in where research happens, who leads it, and who benefits from it. It was established to bridge the gap in evidence, or the 90-10 gap, which exists because very few studies are taken up in the Global South, out of which very few are led by local researchers or set in local priorities. So the Global Health Network works to enable research where this kind of evidence is lacking by connecting health researchers, research organizations, and health workers, and it facilitates knowledge sharing as well as building research capacity. And this is across diseases, types of research, healthcare settings, organizations, and regions. The Global Health Network is also a World Health Organization collaborating center for research information sharing and capacity development. So we say the Global Health Network works towards shifting inequity in health research, but how does it do it? It is by moving information from people who have the skills and knowledge, the expertise, as well as lots of confidence and experience to do the research, to places where it's lacking the necessary skills and training, culture, and institutional support to undertake the research. So it's like a pyramid or a hierarchy of sorts, where the top of the pyramid is taken up by the big grants, the expensive trials, and then the base of the pyramid is formed by the low cost and locally led studies. And what we are trying to do with the Global Health Network is to literally flip the pyramid. The Global Health Network makes accessible the best methods, best practices, tools, training, resources available to those in the low resource settings so that every healthcare setting can undertake the research and evidence is generated from locally led studies that are low cost, accessible, achievable, and can bring about immediate change. It's also about giving the people in those settings the confidence that it doesn't have to be the big research programs, and it's about the pragmatic research that is about measuring what is in front of them and then the evidence that impacts local priorities. The Global Health Network has a vast digital platform. It hosts diverse global knowledge hubs and communities of practice, and these are led by different organizations and networks. This is providing a very powerful working facility for networks to convene and increase engagement, increase the uptake and impact within their teams, but also across varied health research topics and disease areas. And this works in tandem with both in-person as well as online research strengthening programs. They are delivered across the globe through regional partners, through regional coordinators, and through workplace-based learning and local research support activities, as well as professional development for research teams. So this combined virtual and in-person approach is speeding up progress, raising standards, and bringing efficiency, as well as strengthening the systems and careers. The research capacity strengthening activities are in the form of research clubs, supported learning sessions, research topic focused clinics, as well as the 1,000 Challenge. I'll talk a little bit about that later. And there are toolkits and resources available for teams on how to implement these very low on resource activities. The Global Health Network has grown over the years and has relationships with partners across the globe. And they push the objectives of the Global Health Network in the regions, and they are supported by the Global Operations team in Oxford. So overall, the Global Health Network is operating as a franchise system and creating a flat, equitable global organizational structure, but with shared standards, processes, and guidelines. So currently, the Global Health Network has 17 formal partners, and it's across the regions of Africa, Asia, Latin America, Caribbean, and the newly established Middle East and North Africa. And it has also reached very close to 1 million registrations on the online platform. So for every disease, we need a whole ecosystem of health research to get all the answers to the questions, and the difficulties and skills that exist to design and operate excellent health research, it does not vary between disease areas or the type of study. And so addressing skills and resource gaps should be regarded as a valuable investment in general. Supporting all types of health research in every healthcare setting will lead lasting capable teams that can then be brought up to step up to clinical trials. And also with these skills in place, the teams will be able to spot and stop any emergent new threat or outbreak even before it becomes a pandemic. The Global Health Network recently undertook a study for Welcome, and it asked questions about infectious diseases. Over 6,000 participants who were researchers from LMICs took part in these studies. And one question was about identifying barriers in undertaking research studies. And this graph summarizes the combined data on these barriers. So the findings very powerfully show that the barriers do not vary between disease area, type of research, or geography. So the top barriers that were identified were research skills, training, institutional support for research, access to funding, access to equipment, technology, and so all of these top barriers were seen across the globe and in each of the regions of Africa, LAC, Asia, and as well as the global north. So we can see that the barriers are cross-cutting, but the approaches are not necessarily cross-cutting. They are quite fragmented and inefficient because they focus on any particular research program or a disease area. And then the capacity building is also focused on training one particular team for a specific study. But we have to understand that the efficiency will come up when everyone works together, and we need to do research system strengthening as a whole. The Global Health Network is used by research organizations and funders. There are over 60 of them, by being the trusted neutral convener, and it works across specific programs or topics. And it's working with groups like Welcome, CEPI, MRC, EDCTP, WHO, and RDRC. And each of these programs has their own specific focused and curated knowledge facility to convene their funded projects within the specific topic and theme. Each distinct knowledge hub utilizes tried and tested approaches that the Global Health Network has developed to develop highly active and efficient communities of practice. And the Global Health Network has a vast digital platform that connects research organizations with these research teams. It has the investment of technology built into the digital platform and over a decade of how to provide accessible resources and transfer know-how and information to enable tools and resources to be taken up. And so there are tools, resources, recordings of webinars, workshops, e-learning courses, and career development tools that are available on the platform. And these deliver skills in all areas of health research, so ultimately supporting career development and lasting capabilities. The Global Health Network exists within a decentralized franchise organization with partner institutes in the 4 regions, as well as in the UK. So this vast connected community can be leveraged both within the regions and online to support better skills and engagement in research. So currently there are over 50 research capacity and knowledge exchange coordinators who are funded to do the work in the countries, and they are based in local institutes, and they deliver the approaches that the Global Health Network has developed. This is highly scalable and sustainable because the regional partners can also seek their own funding directly coming to them, but as part of the overall Global Health Network. This is about a global initiative, which is called the 1000 Challenge, and it's now available on the Global Health Network platform. It was developed in collaboration with the Nursing Now Challenge, and it is to enable nurses, midwives, and community health workers to lead research studies that gather evidence to address priority issues in the communities. It's a great opportunity for them to develop leadership skills in doing research while also collecting evidence that improves health outcomes in their communities. And again, it's based in identifying the gap that the healthcare workers do not necessarily have the skills, training, or the institutional support to take up research in their own settings. And so what this does is it's providing a study builder tool which takes them through the different steps of doing research, starting with identifying the gap, setting the research question, and then the whole study process up to the point of setting the outputs and sharing their outputs in the form of training, a new protocol guidance, and as well as sharing their recommendations on the platform. At every step of the way, they are connected to these resources and experts, which can help them go on to the next stage. The Global Health Network has impact assessment and measurement built into every project and program. We track access and activity, both in person and online, as well as follow up on the difference this has made to their research and practice over time. It's also a very powerful way for partners to access the wider outputs from their research grants. So this is a few extracts from the qualitative data that has been collected over time. So there's a mixed methods protocol that runs across the program and can be adapted for any activity on Knowledge Hub, and creating a pathway to impact. And some of the case studies showcase how they came across the different resources on the platform or attended a workshop, and how then each data point collecting data on how this helped them with their careers as well as research projects. Another such example of pathway to impact, and this is for a knowledge community. So again, bringing everyone's attention to the Global Health Network platform, which provides access to resources and training. I would encourage everyone to go onto the Global Health Network platform and find e-learning courses, certificates, research toolkits, professional development tools, recordings from past webinars and workshops, as well as the toolkits for different activities that can be set up in local institutions. And if you're working with regional teams, then do make them aware of this wealth of information and resources that is available. So this is the Global Health Network. Not all are here, but we have the team here.